The ankle joint is a complicated joint that is capable of so many articulations and ways of moving. However, the older we get and the more time we spend in shoes, the more this takes away from our ankle mobility, specifically our ankle dorsiflexion, which is how far your knee can pass the toes or how far you can flex that foot. Because our heels in the shoes are usually slightly elevated, it limits the need for that ankle dorsiflexion to go about our everyday life. So a lot of times when I'm training clients, I see these compensations, pronation of the foot or collapsing of the ankle, and compensating by turning those toes out due to a lack of ankle dorsiflexion and or great toe extension, which is another topic for another time. But a lot of times, if we lack this mobility in the ankle, then it's going to take a toll on the foot, the knee, all the way up into the hip and even the lower back. So we want to restore that ankle mobility with some of these movements that I'm going to do with you today that will tackle passive range ankle dorsiflexion and then building up to our active ranges. The biggest tip that I can give you for improving ankle and foot mobility and strength is to spend as little time in shoes as possible. So when you're hanging out at home, taking your shoes off, if you're able to work out at your gym or your home gym with minimalist shoes, socks, or bare feet, that's also a really great way to restore movement in the ankles and the feet. But follow along with this movement sequence so that we can actively tackle that ankle dorsiflexion. So we're going to start with a passive range and we're going to get into a deep stretch and stay there for quite a while before we go into isometric contractions. So what I want you to do is place your foot on the floor. We're going to be down on the floor. You can of course do this standing up as well, almost like a calf stretch, just trying to pass your hip and your knee in front of your toes. But we're going to be doing most of this seated if you're able. I like to stretch into this sort of split stance position so I can get a lot of weight over this supporting foot. But this can be a lot for the knee and the hip, especially if we're here for a long period of time. So you can also sit on a yoga block or a small step stool, pull your foot back towards you and stretch into your ankle dorsiflexion this way. The more you work on this, obviously, the easier it's going to get. So keep coming back and trying these movements and it will eventually get a little bit easier to just be in this deep flexed position. So let's go ahead and start getting into that passive stretch. So no matter your progression, you're going to try to drive the knee in front of the toes. So go ahead and start to shift forward. Now you're going to be lengthening the back of the ankle. So if the heel comes up, that's going to be shortening the back of the ankle. So we want that heel to remain on the floor and you're going to be shortening the front of that ankle. So this part is shortening while this part is lengthening. Now, stay in that stretch. You want to also make sure as you're stretching forward that the big toe is inside of the heel. So we call this like a foot triangle or foot tripod. We want the big toe and the little toe spread out and the heel to be right behind those 2 points. So we don't want that heel to be behind the big toe this way, which again, just feeds into that compensation of turning the toes out. We want the big toe to be inside of the heel and the knee to track over the second and third toes as you're stretching into this position. We're going to stay in that stretch for a little bit longer. Now, I also want you to pay attention to that hip. Make sure that this hip is not sinking outside of that knee. So this is another way to sneakily get that compensation in. We want to pull that hip back so that it's right behind that heel. So right foot is planted on the floor with that foot tripod. The knee is driving forward over the second and third toes, and that hip is right behind that knee. As you are breathing into this stretch, each time you exhale, I want you to see if you can push further. We're gonna hold this for about 30 more seconds before we begin our isometrics. And now I want you to focus on releasing tension from that ankle. So if your calf is tightening up or cramping, I want you to actively try to release that tension. If the front of your ankle is tightening up, if you're pressing down into the floor with that foot, I want you to actively try and release that tension and stretch further into that position. Stay there. I'm going to turn back to this side. So we're slowly getting to end range. Hopefully, by being in this position for an extended period of time, the central nervous system is now getting the message to that ankle that we are safe and okay to be in this deep range. So now we're going to start our isometrics. Isometric contractions mean nothing is actually moving, but we are contracting the muscle fibers and the tissues around the joint as if they are trying to move. So our progressive isometric contraction is going to be to try to push the toes and the ball of the foot into the floor. So it's almost as if you're trying to push out of that position, but that heel is going to remain planted so that you don't actually come out of it. Our next contraction is going to be the regressive tissues, and you're going to try to drive this heel down even more. You can, of course, cue that heel down and try to lift the toes and the ball of the foot especially up towards the shin. So let's try those. Take a deep breath. As you exhale, we're going to do our progressive contraction, pushing the toes and the ball of the foot into the floor. You're going to feel the back side of the ankle and calf engage. Keep that back heel on the floor. Keep pushing for 3, 2, 1. Then immediately go into that next contraction. You're going to drive that heel into the floor, try to lift the toes and the ball of the foot further into that stretch. Now, obviously, we're in our end range, so we can't actively lift any higher, but you're going to try to. And then release that tension. See if you can get a little further into that stretch. We're going to do that 2 more times. So by now, the ankle, calf, foot should be a little fatigued, and that's normal. If you're cramping, go ahead and come out of it, shake it out, and get back into that position. Let's go again. Progressive tissues, we're pushing down. Try not to let it push you out of the stretch, right? Stay as far as you can in that position. 3, 2, 1. Now reverse it. Drive the heel down. Try to lift the toes and the ball of the foot up, up, up towards that shin. You're going to feel the front of the shin working now really hard to lift up. And then release the tension. Try to get further into that stretch. And let's do that 1 more time, pushing down into the floor without allowing yourself to come out of that stretch. 3, 2, 1, and then reverse it. Lift up. Keep lifting for 3, 2, 1. Release that tension, and then very slowly we're going to come out of this stretch, but try to stay in this base position. Whew. So we just really worked intensely into our passive range. Now, if you're doing a stretch to improve mobility, you're going to want to be there for at least 2 minutes. That's where we're actually going to see some lasting changes beyond what feels good. So let's pull into that passive range and then push out of it. So now we're going in and out of that for a kinetic stretch or active stretching. So you can start in whichever base position you prefer. And as you drive forward into that stretch, you're going to imagine you're using those regressive tissues lifting up, 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 up as you drive forward. So once again, we're going into that passive range where you're not actually going to be able to lift that foot, but you're trying to. Then we're going to use the progressive tissues pushing down into the floor with the toes and the ball of the foot to come out of that stretch. I'll show you what it looks like from down here. So as you shift forward, you're driving the heel down, trying to lift the foot while driving that knee forward, and then you're going to push down to come back out of it. Let's do that 3 more times. If you are feeling really good about this, you can add a little more external load as you try to control that movement, pulling into that stretch. And then exhale, push out of it. And let's go 2 more times, pulling into the stretch. Drive that knee forward, lift the ball of the foot, activating the front of the shin, and then push back up using the back of the leg and the shin. 1 more time, pulling forward. Control that movement, find that end range, and then push out of it. So now that we've actively pulled in and out of that end range, let's work our active range of motion. So passive range of motion is your stretch. Active range of motion is what you can actually achieve without assistance, right? So we're gonna shift out of that passive range with your foot slightly a little more in front of you, and we're gonna lift off into ankle dorsiflexion. So as you lift, the knee and the shin and the body should all remain still. So I'm gonna lift up into dorsiflexion and hold. So now we're just actively lifting up, keeping that heel on the floor, and we're gonna make sure that this does not happen. Keep the big toe inside the heel and then slowly bring that foot back down. And then again, actively lifting up. So now we opened that passive range. Now we're trying to achieve that same passive range by actively lifting into that position. This is what really improves mobility with lasting changes. And 2 more, lift, hold, and slowly come back down. And let's go 1 more time, lift, making sure that that big toe's inside the heel. Spread those toes out if you can. We're really feeling the front of that shin working here and down. So we're gonna do 1 more drill on this side before we switch. We're gonna do a passive range hold. So now we're gonna combine the two. You're gonna shift forward into your passive range, and then from the end range here, you're going to drive the heel down, try to lift the ball of the foot and the toes, trying to keep this angle as close to the same as possible as you lift up. Then you're slowly gonna shift back forward, but try to keep the ball of the foot off the floor for as long as possible until it finally takes over and you're in your end range again. Now let's go again. So as you start to shift back, it's almost like the ball of your foot and the toes are pushing you backwards, right? So we're using the regressive tissues to pull further into that position, which is actually pulling you out of that position. And then as you shift forward, we're gonna keep those tissues engaged, trying to keep that ball of the foot off the floor for as long as possible. So let's do that 3 more times. Shift back. As you lift off, try to make sure, double check that your toes are not turning out to the side. Try not to lift one side of the foot higher than the other. Slowly shift back forward. This front of the shin, the anterior tibialis should be on fire. 2 more, shifting back, pulling up, 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 up as soon as you can. Hold. And as you shift forward, keep it off the floor for as long as possible. And let's go 1 more time, drive the heel down. That ball of the foot is gonna push you back into that lift, hold, 3, 2, come on, fight for more. And then slowly come back down. Whew. All right, so let's shake that out. Once again, anytime you get a cramp, just shake it out and try to get right back into that position. And let's repeat all of that on the left. So we're taking 2 minutes to breathe into that passive range. So whichever progression you're working with, base position you're working with, we're trying to get this side of the ankle short and this side of the ankle long. So we're breathing into that position. Double check with that foot pyramid. Do you have the big toe, the ball of the big toe, the ball of the little toe planted with that heel straight behind both of them? Make sure that you're not collapsing in on that ankle. So if I had my finger right here under the outside of your foot, I want you to pinch my finger with the outside of that foot. Make sure the knee is tracking over the 2nd and 3rd toes, and then make sure that left hip is not pulling out to the side. Keep it right behind that left heel. So that may change your base position slightly, which is totally fine. We're just looking for this side right here, okay? Now we're gonna focus on relaxing the tissues to get deeper into that stretch. So the heel is gonna remain down. Sometimes it's nice to cue this heel by placing your hand right at the base, thumb on the outside, index finger on the inside as you stretch forward, just to create a little more length in that heel and a little more shortness in the front of the ankle. With each exhale, you want to try to release the tension a little bit more. Make sure you're not pushing that foot into the floor. We want the central nervous system to relax in this position. We're changing the tissues and teaching the body that this is a safe position with which to work. Good. So we're going to start those isometric contractions. So we're starting with our progressive tissues pushing down into the floor, and then we're going to work with the regressive tissues trying to pull up off of the floor. So we're going to do 3 reps. Go ahead and take a deep breath. As you exhale, let's start our first. You're gonna drive down into the floor with the toes and the ball of the foot, pushing, 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 but don't let it push you out of that stretch. Feel the calf and the back of that ankle working, and then immediately go to that regressive tissue, driving the heel down, trying to lift the foot and that shin without coming out of that stretch. 3, 2, 1, and then release the tension. See if you can get a little further into that position. And let's go again. Drive down into the floor, pushing through the toes and the foot. Don't let that heel come up. Don't let yourself shift back. Keep pushing for 3, 2, 1. Right away, reverse, lifting up, pulling that ball of the foot off the floor. Feel the front of that shin, top of the foot, front of the ankle, working hard. 3, 2, and release that tension. See if you can go a little further into that stretch. One more time. Take a deep breath as you exhale. Drive down, push into that floor. Each rep trying to ramp up a little bit more intensity. So I'm pushing with a little bit more force for this last rep. It's reverberating all the way up the leg into that hip. I'm pushing, 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 and then reverse it right away. Drive that heel down. Try to lift that foot and the shin without coming out of that stretch. 3, 2, 1. Release the tension, and then slowly come on out of it. So now we're gonna work with that kinetic stretching, pulling into that stretch and then pushing out of that stretch. If you feel really good about these and you've been doing them for a while, you can add even a little external load to this movement. So we're gonna pull into that stretch, driving the heel down, trying to lift the ball of the foot, controlling that movement, and then you're gonna push out of it using the ankle. As you pull forward, lift the ball of the foot towards that shin, drive that heel down, and then push that ball of the foot down to come back out of it. So we're teaching the tissues how to work in and out of this position. And then push down to come back up. Let's do last 2, each time trying to pull a little further into that end range. And push to come back up. We'll go one more time. Pull into the stretch. Pull, 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 pull further, and push out. All right, so now let's work with some active range of motion. We're gonna go to our end range, and then we're gonna shift out of that slightly. So we're gonna make sure that we can actually lift off here. The lift off should not be huge, but we wanna be able to actually lift off away from the floor. Base position is nice and solid. We're gonna lift the ball of the foot. See, that's a little bit too high, so I'm gonna shift a little further forward so I can lift just like an inch or 2. Make sure that the toes are spread out and bring it down. Really feeling the front of this shin working, front of that ankle, top of the foot. Spreading the toes, make sure one side is not lifting higher than the other. And down. Make sure that the big toe is not lifting and pointing out this way. It's inside of that heel. Hold. And come back down with control. Last 2, lift and hold. 3, 2, 1. Slowly lower, spreading out those toes. And we'll go one more time. Lift up and hold. Drive that heel down. Really try to find that front of the shin, top of the foot to lift higher. And slowly come back down. So let's combine the 2 to finish. We're gonna go into that passive range and then try to hold that angle as you shift back. So we're gonna shift forward into passive range. Now, it's almost as if that ball of the foot lifting up is going to push you out of that range so you can lift and hold. 3, 2, 1. Now you're gonna keep it off the floor for as long as you can before you go back to that passive range. Now lift up from the bottom. Allow that to shift you back into your active range. Hold. 3, 2, 1. Slowly coming back forward. So with these, we're really trying to close the gap between your passive stretch and your active lift off. Lifting up. Now you're never going to fully close that gap. Your active range is never going to be as deep as your passive range, but hopefully we can, in your passive stretch, produce some force there. So we want the tissues to be able to produce force and withstand force in that passive range. And we'll go one more time, lifting up, Shifting back and hold, spread out those toes, drive the heel down. Come on, lift further, higher, 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 and slowly shift forward. Ooh, releasing that tension. All right, and shake it out. Nice job. So that's just one articulation of the ankles. We can do this same exact routine for all of the articulations of the ankles. This is just one that I see that really needs help the most because of the nature of our shoes and being in shoes all the time and not necessarily needing that ankle dorsiflexion in everyday life. I hope you learned something about your ankle mobility today. If you have any questions, drop them in the comments below and I'll see you next time.